Good morning, everyone. My name is Errol Fields. I'm with Johns Hopkins Center for Child and Community Health Research, and we work really closely with the Baltimore City Health Department for our Thrive project. I'm going to talk to you today about one component of our larger project called Baltimore in Conversation. So our city health department really wanted to focus on some of the biggest barriers to HIV prevention and treatment in our populations, our LGBTQ populations of color, which are stigma, discrimination, and medical mistrust. And we really wanted to focus on those aspects of care so that we could engage the community in the work that we were doing. So there's several components that we developed as part of this social marketing community engagement campaign. Cells, which I'll talk to you about at length during this presentation. Storytelling nights, which was an opportunity for folks from both the medical community and the LGBT community to talk about their experiences and to share their experiences with one another over a series of nighttime storytelling events. Project Presence photo exhibition, which was an opportunity to reduce stigma and increase visibility among LGBTQ persons of color through a photo campaign, as well as our social media activities. But I'm going to talk to you specifically about our cells. So the cells are basically, for lack of a better word, unstructured focus groups, but they're really not they're really meant to have the individuals who participate in the cells to talk about what they want to talk about. So there's not a guide, there's not a discussion questions. People just basically come together over a meal and talk about the things that are important to them. So it's really an opportunity to foster community among individuals within the community and an opportunity to sort of speak to things that are important to them. So we have this is a picture of one of the cells. Again, it's over a meal. People invite their friends to come and talk about a certain topic. I'm going to talk a little bit about the nuts and bolts of the process, and then I'm going to get back to sort of how our evaluation team and the City Health Department really worked together to develop a way of evaluating this actual event in a way that was not intrusive to the event and didn't take away from the actual event. So we started off the process after having a couple of spontaneous cells, by recruiting individuals through social media ads and word of mouth at some of our other events. Each person invited three to five of their friends to come and talk about a topic that was important to them. And then at the end of that topic, the participants were given 5 cards to give to individuals in their network to create another wave of sort of cells. So each person had the opportunity to bring another 3 to 5 friends with them to have another conversation or discussion. Each individual was given this card, which had information that allowed us to track recruitment, the method, the reach, and encourage participation in future cells, and I'll show you a picture of that in a second. Also at the events, participants completed a survey that gave demographic information that helped us to assess whether or not we were reaching the full population that we wanted to reach. And the cells were also audio recorded so that we could transcribe and capture key themes as they came out of the conversations. So this is what the actual card looks like. So it has this logo, which was created by the community, Baltimore in Conversation. Again, as I mentioned, they were given this brief 11-item survey where they wrote their coupon code and provided their demographic information, and those codes were used to respond or to determine where that individual was recruited from. So this slide really speaks to this sort of iterative process that the health department and our team worked together on to really develop this program. And this is really where I think the innovation comes from, is how we all work together to create this. So I'm not sure how well you can see that, but the first point there at spring 2016, the City Health Department developed this idea to have these cells, again, to reduce stigma among LGBTQ plus persons in Baltimore. And work with our evaluation team together to kind of develop this further. So they held 2 initial cells in the summer of 2016, video recorded them and posted them on Facebook, and was very popular. People really had lots of comments about the actual cell and about the actual conversation that occurred. And we wanted to be able to sort of continue that process and continue this opportunity to talk with members of the community, for the community members to talk back to the City Health Department about what they were concerned about. So we proposed incorporating the demographic survey that I mentioned to you all to assess sort of the reach and to incorporate respondent-driven sampling strategies to sort of spread the opportunity out to other members of the communities. We also decided if they were already going to be video recording, that we should also audio record them so we can transcribe them and actually do analysis to see what the themes that came up from the cells. We proposed these things. The city health department provided feedback on that particular protocol. They wanted us to use a paper form as opposed to like an electronic survey because folks felt like that was going to be too intrusive. They also wanted us to remove, really reduce any questions about HIV status and other things that we thought were too intrusive and that people wouldn't really want to fill out. So we took those things off the survey. And then we worked with the City Health Department to incorporate all that feedback and to continue the process. So we sort of had this iterative process where things continued to come up that we worked together to smooth them out and to make it continue to be a really community-driven event that wasn't super obtrusive. So we used the qualitative analysis of the transcripts to really identify themes that were important to the community and also gave us opportunities to sort of develop additional themes that we thought would be important for people to talk about. So one of the things that really came up, which really stemmed a future cell, was that people felt like they were being discriminated against or they felt uncomfortable going to black barbershops. So we decided to actually have a cell of black barbers to really unpack that scenario more. And that actually led to a very dynamic conversation, which again was posted on Facebook, and then people began to identify, well, this is a barber who's willing to engage in conversation, so I'm gonna feel more comfortable going into that space. So it created a safer space for our gay and bisexual men in Baltimore City, which sort of evolved from this initial cell where people were talking about that being an uncomfortable space for them. So some of the things that we wanted to measure from an evaluation perspective was it feasible to host these cells and use an RDS strategy to recruit from this event? How far were we able to reach into the community to really make sure that everyone's voice was being heard? So we define reach as diversity of LGBTQ persons, especially gay, bisexual, other men of sex with men, and also transgender persons, both men and women. And we use demographic, geographic, and venue or event-based indicators to make sure we're really reaching throughout the city. And then how effective were these cells in decreasing internalized and external sources of stigma related to sexual and gender identity, as well as HIV status among our priority population in Baltimore City. So this is just some information about the number of cells that we've had and the number of cells that we wanted to have. We really wanted to have about 240 cells in our first year. We ended up having, in our first 48, we wanted to have 48 cells in our first year and 240 participants. We ended up having about 16. We felt that we were getting lots of new sort of seeded cells, but not kind of the waves of additional cells based on the seeding wasn't as happening as effectively. So we modified that strategy a bit and had some staff to work specifically on that and have increased that somewhat. But we also decided we wanted to be able to have the flexibility to expand to other topics and other communities like the barber shops that I mentioned before, and that's what we focused on for this year. But we've reached a good diversity within the community. 75% of Baltimore zip codes have been represented by these cells. Our mean age is about 30 with a range from 20 to 58, so one of our targets is to reach a little bit of a younger population. Again, this is for the entire community, so 16% are transgender or gender nonconforming, 75% identify as sexual minorities, majority are persons of color, majority have income above the poverty level in Baltimore, but a number have had insecure housing. 50% of the participants were living with HIV. And then we wanted to, again, we did use qualitative data to really get a sense of what the major themes that were coming up out of these conversations. So we transcribe and analyze the cells quarterly and using a grounded theory approach to discover the themes and variables that emerge as we're reading through the data. And again, this is informed our seeding of participants in topic areas for subsequent cells. We still don't have a guide that we ask people specific questions, but we have a general topic area that we want folks to address. And again, that's come from these other previous cells and things that have come up as part of those previous cells. And so these are some of the themes that have emerged. Lots of things emerge around stigma, so unintentional stigma, so people feeling discriminated against based on things that people have said, but they may not have had the intent to make people feel badly. Feeling stigmatized by external communities, internalized stigma in the workplace, stigma within the LGBT community between different groups in the community, and the use of slurs. And I just wanted to, these are some of the quotes that came up out of the cells, one from a gay man, another from two trans men. So the first one is they relive the hurt within the gay community. You can feel if you're sensitive or feeling things, sometimes you can go into neighborhoods in Baltimore and feel the energy, the negative energy. You can feel it. And then a trans man in another cell said something that jumped out at me, even from back home, and just generally in the LGBT community, physically because of the changes of transgender people when they refer to, I would say, people as it, you know. And I've heard that so often, and then how can you describe a human being as it? And then another trans man says, and a lot of times within our community, because we've made the change, we are the problem, and that's not the case, and it's not the truth. I don't want any trans person or trans masculine person or genderqueer person to ever think that they are the problem. So these are just some of the quotes that have come up that have spoken to some of the stigma that people experience, and it's really informed not only these additional cells, but some of the other programs that I mentioned briefly as well, as ways in which the health department can continue to engage the community, but also help them meet the needs that they identify as important to them. And so we've felt that this is really a feasible way to reach out to different communities in a way that is welcoming and inviting and allows people to feel that they are empowered to talk about what's important to them. We found that it does require significant time and follow-up to sort of continue the cells to keep them going, but people continue to be excited about them and continue to want to engage. It's a great data collection tool, and it's an important way of, again, engaging with the community. And then we've been able to share these findings, a number of different opportunities within the community. It's really important to share back information that we're gathering. So we've had a couple of workshops, which we call Baltimore in Action, where we've shared back a lot of these findings and had the opportunity for members from the community to really develop, so what are we going to do with the things that what we've learned and what we found out. So we've shared that both last year and again just a few weeks ago back in March as well. To sort of continue to engage the community and continue to have them be part of the process. And I think that's it. I just wanted to, I'm from the evaluation team, but we've had a number of dynamic folks, including Ken DeBatamosi, who's really led this effort and come up with lots of these ideas for these cells, and he wasn't able to be here today, but also to acknowledge him and the rest of our evaluation team and our community partners, and of course the funding from Thrive. Thanks.